Hello and welcome from Edgehill University to What's in Your Head, a series of podcasts about mental health, where we have open and honest conversations about what's really going on in our heads. I'm Gareth Roberts and I'm joined as ever by former Premier League and former England goalkeeper Chris Kirkland. And today our guest is Professor Michelle Howarth, Professor in Health and Social Care here at Edgehill University. Now, we've got Michelle on today because she's got a specialist interest in something called social prescribing. This is connecting people with activities and support beyond medication. And it can be things like gardening, walking, volunteering, or just being part of a community group. Things that can really make a difference to your mental health and well-being. Michelle's worked with national organisations, charities, universities right across the UK. And she's passionate about making care more personal, more human, and more effective. So let's get into it all. And as usual, what we always do is have a bit of an icebreaker, and we ask our guest, what is in your head? Now, I've already briefed you on this, Michelle. We don't want to know about, do we need to go and get some shopping? It's more, if you're having a bit of a grey day, if the weather, if you like, in your life at that time is a bit rainy, you're not feeling your best, what do you do? What's a little thing you might do that helps you bring you back to feeling yourself again?
Absolutely brilliant question, because we all have those days, don't we?
Yeah.
And I have a selection actually, but I think top of my list is getting out there in nature. There's nothing that quite compares with the smell, the surroundings, the sights, the sounds, just to give you that buzz and make you feel better. If there's a hill and somewhere to swim at the top of that, getting out in nature, even better. Cold water swimming, if I can get up there, is amazing. But that's my first port of call each and every time. And if I can't get outside, I go to a window and have a look, see what I can see, and it just gives you a buzz every time.
It does, doesn't it? And I'm interested in the sort of the cold water thing, because I know, Chris, you've got a bath of ice in your back garden.
I have got one of them Loomies, yeah. So I always used to love ice cold therapy when I played. So obviously ice baths after training and stuff, and it's something I've always. But then I stopped. But then I started up again about 3 years ago. So I have the ice cold showers every morning, and I've got the ice bath outside. Yeah, but I was at Michelle's inauguration. Have I said that right?
Inaugural, yeah.
Inaugural last week, which was amazing. I could have listened to it all day. So I know where your favourite place is to go. Do you want to tell everybody else where you do?
Yeah, I guess people who go swimming at Gaddins in Todmorden are probably going to kill me now because no, don't tell everybody. But actually there's a place in Gaddins just outside of Todmorden, and it's Gaddins Dam. It was built in the 1830s by the local mill owner, and it was there to service the mills. And if you can get up the big hill that gets you there, at the top there's the most amazing space. It's just a huge dam, it's clean, it's safe to swim in. There's a little beach there that claims to be the highest beach in Britain.
Oh, wow. And
there's two schools of thought about it. One is that the mill owner, when he made the dam, put the beach in because he realised that all the people who were working in the mills couldn't afford to go on holiday, so he actually put this beach in. And the second theory is, the geologist type theory, is that it was actually created naturally because when you get up there, it's quite windy, and the prevailing winds has kind of taken all this sand up that end.
Right, okay.
You like the first option,
I like
though, don't
the
you?
first option, yeah.
Yeah, that somebody put it there.
So you've got ice baths.
Yeah.
You've gone wild swimming. Now the electricity's gone in my flat, and so I've had to get cold showers all week.
Yeah.
It's not quite as good, but I've had to get cold showers to start my day. It does wake you up, doesn't it?
It does wake you up. It's more when you're in it, it's not pleasant to start with, but it's more when you get out and then the following hours after it.
It's a way to consider starting your day, isn't it? Okay. Well, let's talk about your story then, Michelle. How did you get into what you're doing now? You started out in nursing, I believe.
Yeah, so I went into nursing at the tender age of 18, so a long time ago. And I was always thinking about where we put the person and how we see that individual. So, for example, when I went into nursing, there was the huge AIDS crisis at the time in the early 80s.
Yeah.
And there was a lot of stigma and fear associated with that because obviously it really did target the gay community at the time. Nobody knew why. And one of the first people that I ever nursed when I was 18 was a young lad that had developed a pneumonia as a result of being immunosuppressed because of the HIV virus, and he ended up being a full-blown AIDS. And I just remember thinking everyone was really scared, scared to nurse him, scared of what would happen. And not only did this young lad have to fight the stigma, but he was fighting for his life, because then it was a death sentence. And I'm always mindful that in nursing, we kind of trained in this kind of pathogenic model. So signs, symptoms, we look at someone and go, right, we know how to fix you. We know what to do to make you better. And I always think, actually, there's a person in there and somebody who we need to be thinking about, well, what's the strengths-based approaches? What's important to them rather than what's the matter with them? So I've always adopted that philosophy throughout my entire nursing career, and then into my academia. I started to think about what makes us feel well other than pills, packets, medicines, potions, etc. And that's when I started to get involved in looking at social prescribing as a way to enable people to access non-clinical assets within the community, groups that make us feel better. And then I further refined that down to, actually, nature's out there. It's free for most of us. Why aren't we engaging with nature to give us that boost? It affects us physiologically. It boosts serotonin. You mentioned earlier about boosting endorphins. Serotonin is our happy hormone. And being out, getting cold, being out in the wind, all of that is really boosted. So we've got really good evidence to say being out in nature really does improve your mental well-being. And we need to get more people doing it.
It's not, you talk about the evidence, but it's true, isn't it? Yeah. It's so true. You just spoke about you've been up a few mountains and stuff, and you can talk, but it is so, like you mentioned the serotonin there. Obviously, I was on sertraline for many years, antidepressants, and listen, at the start, they helped. And listen, we're not telling people that you shouldn't be taking this, shouldn't be taking that, because people do. But for me, I will never go back onto that.
I was on it as well.
Yeah,
I wouldn't go back on it.
I would never go back onto it, no. Because stuff like this, it's probably one of the only things that's free as well now. Getting out in the open, you can go to places, you can go to that lake that you go to as well. But having been through what I've been, I would never go back on pills.
I find all your stuff, Michelle, like really heartening, because you're talking about sort of moving away from like a clinical gaze and leaving diagnosis at the gate. It does kind of feel that it's almost doctoring by numbers sometimes with it, So when I went to the doctor and said I feel down, I feel depressed, all this stuff's gone on in my life, and I'm having some unhealthy thoughts, shall we say, I kind of felt like there was someone sitting there ticking some boxes rather than asking me and talking to me, and so to hear you talk about, well, your answer might not be, it could be, as you say, but your answer might not be in tablets, might not be in drug, it might be you just need to consider this. You need, maybe socialising, maybe getting out walking, nature, as you say. Because all of that now, I've really embraced that, and I love walking now. I walk all the time on my own with friends, up mountains, on beaches, wherever it might be. And if I don't do it, I notice the difference. And if I do it, I notice the difference. You know what I mean? And again, like you just said, I wouldn't go back to that. No. I wouldn't want to go back to that now. With
a doctor, you mentioned, listen, I'm not criticising doctors at all. They do an amazing job, but they get so many people through the door. They've got a certain limited time of people. Sometimes it's easy for them to say, look, try this, try that. But with what you're hoping to try and get in, that's the way forward.
Absolutely.
And listen, it's not for everyone. Like I said, I'm not saying you shouldn't be taking this, shouldn't be doing that. It's not for you, whatever. But I think in general, if we can go more down this route and give people the opportunity, it might not work for them. They might still need the medication. But if they've got the opportunity to try something different and something that's more natural, I'm all for that.
Where did you, was there a specific trigger for you to start to move towards the social prescribing stuff and for that to really sort of interest you?
I think for me, when I found out that it was all about what matters to an individual rather than what's the matter with them. So when somebody's referred by, it could be a health professional, any clinician, to a link worker, that link worker has a wellbeing conversation with the individual, and they'll sit that person down and go, right, okay, what matters to you? And through that kind of conversation, they can identify potentially what might benefit them most. So that link worker then works with that individual over, a couple of sessions or more, and literally takes them to wherever they need to be. There was a lovely example as one of my research a number of years ago where I talked to a link worker and I said, what stands out most to you? And she goes, well, I remember working with an octogenarian So this is a woman who is well into her 80s, lived with her husband at home, and she had really bad tinnitus. She was up at night with it. She was rowing with her husband. She getting a poor night's sleep. She wasn't eating, drinking all that well. They'd been married years, and they were at cusp of divorce, and things were really bad. And she said it turns out that she'd been taking a particular painkiller for years. And she kept going back to the GP, and it was when they used to just do repeat prescriptions without checking. So they do check now, I have to say. Anyway, she had a chat with the link worker, and the link worker says, well, what kind of things makes you happy? Because the GP kept saying, well, I don't think I'm helping you with these tablets anymore. So it turns out this woman used to be a weightlifter. I know, go figure. And so she said, well, if that's the case, then there's a local gym down the road. I'll take you there. She goes, I can't go. So this link worker literally took her to the gym. Now, because she's over 80, the people at the gym absolutely love her, took her on board, and she started lifting weights again. As a result of that, her core strength improved, her back improved, she didn't need the painkillers, the tinnitus stopped, relationship improved. The knock-on effect was amazing. GP's going, thanks very much. Link worker's going, there you go, you're all right now. And she still goes to the gym. And that's just one small example of, that person took the time to sit down and go, right, what's important to you? What did you used to do? What makes you happy? And it worked all around. It worked for the husband, worked for the wife, worked for the link worker, worked for the GP. And it is estimated that, probably about 30% of people go to a GP who don't really know to go there. They're there because they're socially isolated or they're feeling anxious. And so the whole thing about social prescribing is to try and, say, right, you don't need a clinical prescription. What you do need is to get out there more, as you say, or to socially, mingle or, join into a club. But it's finding out what matters to that person. That's what drew me like a moth to a flame to this social prescribing, because I thought, that's it, that's the essence of it. So, yeah.
And a lot of your work as well is around sort of, you've already mentioned it, nature and impact on mental health of nature. That kind of stuff, outdoors, green spaces, all of that kind of stuff, I guess, and having read up on you, it seems to be part of your argument academically. If you're like, it's almost, what's the science behind that? Like, what is actually why is it good? Because we know it is, and we all say it to each other, but why? Why is it good?
So we know physiologically, it being out in nature can kick off and help to produce serotonin. So we know physiologically that happens. There's a great little book written, and I can't remember about her full name, Florence somebody, called The Nature Fix. And she was a New York novelist at time. She was a journalist for the New York Times. And she went all over the world talking to neurologists about why does nature work. And they were showing, well, we've done MRI scans. We can show you parts of the brain that actually are triggered and improved and X, Y, and Z. We know that people with dementia can engage better with their loved ones when they're outdoors. They reconnect in some way. So we know physiologically that it does work. On a broader scale, we know from subjective self-reports, so, people that fill in questionnaires about their mental health, we know that if you tested them before and asked them what their mental health was before they started a green intervention, for example, and then tested them during and after, those scores will improve. And we've done that a number of times, and we can claim statistical significance because that works. What we're currently doing at the moment, and I'm involved in a huge project called Green Me, is we're doing randomised control trials across 6 countries. To try and understand what are the benefits of nature and gardening and being outdoors for mental acuity. Those trials have just started, but they will add to a growing evidence base of more experimental type studies that hopefully will convince more people that it's not just self-reported. Physiologically we know, self-reporting we know, but actually through these randomised control trials we'll have a really good sense of the evidence as well. So we're getting there, it's growing.
Can I ask, so what's the obstacles? Because it all just makes total sense. So when you're going to like the NHS or these different organisations saying, listen, this is the way it's been proved, this is the way forward, what are the knockbacks you get?
I think because as a clinician, as practitioners, we are driven by an evidence-based culture. So we need to know that what we are prescribing and doing to somebody is effective, and we're doing it for the right reason, and we're very we risk assess that. So the types of studies we need to use and the types of studies that kind of influence that evidence-based approach are those studies that can generalise. So the bigger the sample we have, the more we can say, right, it's worked for hundreds of people, so it could work for 10,000 people. And the more we can manipulate and control those experiments to make sure that this intervention works because of the intervention and nothing else. So that gardening programme works because of the gardening programme and nothing else that's going on in that person's life. The more confident we are in the results, the more then we can say, actually, yeah, I'm okay to prescribe this. I'm okay to encourage this because there's a really good science base behind it. So that tells us what works and for how many, but we also need that qualitative research to tell us why it works. You know, why is it important to an individual? Because you might have the best approach, the best drug, the best therapy in the world, but ultimately if that person doesn't want it, then they can just say, get stuffed, I'm not having it. So we have to take it on board. We have to say, you know, this is based on our clinical judgment, but in conjunction with your personal preference as well.
I don't know about anyone else here, but I just feel like, you know, really small, like natural things make a big difference. So, you know, now that I've got into climbing mountains, if I see one now, I'm like,
You want to climb it?
you know, so as an example, there was a really clear day the other week, and I was walking along the front at Crosby, and I was looking over towards Wales, and I could see Snowdon because I could recognise the peak. And I've got, being sad, I've got an app that identifies peaks and mountains. And so I checked, and it was, and I was so made up.
Yeah.
I was like, there's Snowdon right there.
Yeah.
And another little one like that was, I don't think I'm a great gardener by any stretch, but I quite like the idea of it. And I've got a flower growing on my windowsill, and I ate an apple, and I thought, I wonder what happened if I put the pips in there.
And it is growing.
And I was washing the dishes the other day, and I was like, that's grown. That's that's them pips. Right. And I was so made up about it.
And you water it each side. You water it as well, yeah.
Yeah.
So that becomes part of you.
But it's just like really little things, but like they just take it away from
Give you
the
joy, don't they?
stresses of the day. Yeah.
Absolutely.
And it's like, you know, now I'm thinking about that, or I'm thinking about a mountain, and I'm not thinking about.
But
the
they're
stresses
healthy. They're healthy thoughts in there. Yeah. It almost becomes like an addiction, doesn't it? Like with me, the exercise now, walking, it is an addiction. Yeah. But it's certainly a far
positive
more
one.
a positive.
Yeah. I mean, I wanted to talk about, you know, what we've got right here at Edge Hill as well, because, you know, I used to work in the press office here, and it almost became a cliche thing that everything we wrote or talked about, we would mention the beautiful campus. But it is. You know, we're not messing when we say it, because, you know, it's a great place to be. There's a walker right around the campus. Ormskirk generally, West Lancashire generally. There's lots of great walks on the doorstep, isn't there? And I know you're doing some stuff with students. Chris, you're getting involved and stuff. Do you want to talk about some of that?
Yeah, so we did what we call a dose of nature walk on International Social Prescribing Day in March. And basically we invited people from the local community, staff, students. We worked with the wellbeing team here to say, let's get on walks. We just literally walked around the campus. We attracted about 60 odd people to that. And as we were walking around, I mean, the trail was, the one thing we did learn, ironically, was we said, right, someone can head up the start, someone will be in the middle, and someone will bring up the rear. So, and we'll all have our phones on the WhatsApp, because we can keep in contact with each other to find out, you know, to make sure everyone's keeping up. So on the day, I was keeping up the rear with my colleague, Eve, and there was somebody from a local community group that came along and they went, right, we're part of a walking group. And of course, we're that busy chatting and talking, we were like falling back and back and back. So I'm trying to ring up Millie, who's at the lead, going, Millie, we need to slow down a bit. Of course, they're not on the phones because they're engaged in nature. They're talking and you just start flipping at the irony. Every day is a learning day. So we're going to get walkie-talkies for the next one. So the idea is that we get people out and about, talking about mental health, talking to the community, talking with students, talking with staff, and we use the campus and we just walk around the campus and just enjoy that 30, 40 minutes outdoors. We don't really measure it, we just get out there and walk, and it's just a brilliant opportunity.
In terms of, you know, it's not just here, obviously, it's, as we've already talked about, it's, you know, the NHS has started to run some testing, hasn't it, around green social subscribing and things like that as well. Do you think we're going to, or when do you think we're going to move from it being seen as an add-on or an extra or a trial to something that's standard?
Brilliant question. I'm about to address that in a keynote in a couple of weeks. It needs to be business as usual. And it might be the little things. So at the moment, we know we've got good evidence for the impact of nature on well-being, whether it's walking, digging a big hole, swimming, or what have you. In a lot of instances, there might not be the access. So, for example, we talk about green and blue spaces, but not everyone's got the ability to just step out the door into a nice space. And so there's that kind of, how do we build it into existing infrastructures? And I'll give you a lovely example of a place that I visited a few months ago, and it was in a really, really deprived area, loads of high-rise flats. There was broken glass there was needles, you name it. And right next to the food bank was a little garden, no bigger than this room, with some raised beds. And in that space were people, a lot of them were asylum seekers, first language wasn't English, a lot of people unemployed for a variety of different reasons who'd accessed the food bank. And then they were working in this little space with people from the community. So there were, it was a place to come together. And it wasn't seen as special. It had been there for a while. It was part of that community. It was part of that food bank. We know that organisations are working with the NHS, for example, to improve the green spaces within the NHS, so that if you're in hospital, the last thing you want to see is a few dead trees. You want to see a bit of biodiversity in life. So it's how we put green spaces into places where they might not exist or you might not expect. But it's also making sure that our practitioners, our service delivery partners, are able to kind of work in a cross-sector way, so that the voluntary sector isn't constantly having to apply for money to do the things that they're brilliant at, and that's making a difference to people's lives. And if we can start to see it as a whole service, a whole integrated service that is business as usual, then that kind of reach for that pot of the money, which is never at the end of the rainbow anyway, starts to become a little bit, well, we don't need that. We're part of a system. How we do that, I have no idea, but it's about starting the conversation, and the first step to that is improving access as well for everybody.
And you've done stuff as well where it's with children and young people, haven't you? You've done stuff at Barnardo's, and there's something up in Cumbria. I wanted to ask you a little bit about that as well, because, I think there's maybe a bit of a thing, isn't there, where, younger people hear gardening and think, well, that's something my nan and granddad do, or you know what I mean? It's maybe not seen as cool in some way. So I was interested when I read that. I thought, well, when you're trying to sell in that to younger people, was there some reticence at first? Were they a bit like, but then I guess the other side of it, when they've had to go and got their hands dirty and dug holes, like you said before, the other side of it, were they like, oh, actually?
Yeah, it's interesting, because I know some of the work that Barnardo's doing is reaching out and utilising like forest schools and journaling clubs, nature journaling clubs, and they do get an awful lot of benefit from that. And once you get kids engaged, I think sometimes it's how you get them engaged. So there was a piece of work that I did with the RHS Schools Gardening campaign, and it was the awards ceremony. And we were working with the children and the young people from different schools, and we're like thinking, how do we keep them engaged while they do these awards? So there's one school going in, getting the award, and another school was outside creating havoc, I should imagine. So we said, right, okay, we'll set up a treasure hunt outside, and we'll use iPads. And so when they scanned over an image, it sent them to the next clue. So they're using technology to go outside, and it makes it more exciting for them. And there's all sorts of different ideas that you could weigh, because it's like, how do you get them off the phones? Well, maybe we think about, how do you use the phones to get them to engage in nature in the first place? And I don't know anything now because my son's 20, but I've heard of things like the Pokemon appearing in places, and could we have them appearing in forests? Could we do something where you are getting them outdoors? The other thing as well is, you infect kids through nature, through outdoor sports. Football's a brilliant one, isn't it? Cricket, all of those, although when it rains, cricket's cancelled usually. But, that kind of getting people outdoors and engaged with nature, they don't even realise the benefits they're getting by being outdoors, the smells, the sights, the sounds, and they get all that, that pleasure from kicking a football around or kicking whatever, and actually they're getting additional benefits that they don't know about. So there's sneaky ways of getting nature in as well.
It's not new though, is it? It's like, because I remember being a kid, going for walks, going to local parks. We used to go out as families, going somewhere and doing all that. So that's always been been natural to me, I think. But I say it's not new, is it? It's just making people realise that it's there, it's on your doorstep, it's free.
Yeah.
Go and do it.
Yeah, absolutely.
It's like the prevalence of technology, though, is going up and up and up, isn't it?
Well, listen, you're right there. Yeah, back then, no phones. And
exactly.
I mean, I remember my uncle having his first phone, and it was one of them. Like, it was literally like a brick, and I thought it was the best thing ever. But you're right. There's obviously, but with what you're saying, can you then interact the phones to make a positive out of it instead of them scrolling through TikTok or whatever?
Because I think generationally, I'm nearly 49, and so I climbed trees, jumped rivers, played footy from dusk till dawn, and all that kind of stuff. But I look at my own kids now, and if you let them at times, they would sit in the room all day and be on the phone, and it's like, I get why, because they're socialising, and it's sort of their way of doing it. But equally, I'm not, without any academic background here, I'm just sort of saying this anecdotally, but I'm kind of thinking, is that the healthiest thing you can be doing? Wouldn't it be good for you to go outside, to see nature, to go for a walk, to climb a tree, to jump a river, whatever, all the stuff we used to do? And I think, as you say, maybe trying to find ways we can strike a balance. I mean, I like taking pictures as well, so I think if you're out in nature, you're likely to be able to take some nice ones.
Amazing stuff.
Do you know what I mean?
Especially on top of mountains.
Yeah, and so you can do both. You're using your technology, but you're out in nature at the same time as well.
It's a massive. What you're trying to do, it's huge, isn't it? It's not like you're saying it now and tomorrow it's going to happen. Yeah. But for you to try and make the difference like you are doing and to try and change things, I think it's unbelievable. I really do, because the benefits, it's going to help. So it's going to take time, and you know that. But like I say, you've got to start somewhere, and if you didn't do it, who would be doing it? So I think what you're doing is incredible.
I think you've mentioned there, you got it in right at the start about sort of your favourite spot to go. Well, what you live fairly locally, so what are your spots locally as well?
So I love my favourite now is Formby Beach. So go down, take the dogs. Partly because Sam, my older dog, will not walk on the lead on the roads now. He's just took a dislike to the bangs, the sound. So he only goes to Formby Beach now or down Winifred Park. But I love Formby Beach, love walking through the Squirrel Reserve, love going on to the sea. I love going down to the sea. I love seeing him in the sea, love walking along listening to the waves, listening to the crashes and all that sort of stuff. And now, obviously, in the summer, it's lovely, innit? You go down there, you see the sunset. But that, for me, Formby Beach is my place.
Oh, I used to go there a lot. A couple of months ago, actually. It's just stunning. And as you walk through, because you've got a bit of everything there, haven't you? You've got the massive expanse of the beach, plus you've got those beautiful woods and forests, and then if you're lucky enough to see a red squirrel, then it's like a bonus. Bonus. Yeah.
And so, people who are listening now and, they're maybe thinking some of this sounds interesting, maybe they're at Edge Hill, there are students here, how can they sort of get involved in some of this stuff that we've mentioned here then?
There is actually, A, they can contact the wellbeing service because we've got a social prescriber now called Yasmin Armstrong, who's amazing. B, there is a gardening group, a student gardening group here. So there is a lot of work going on now to try and re-establish at the back of the crime house. There's a polytunnel and a greenhouse and a space there. And so they're trying to re-establish that so that we can start to use that and grow things and get students engaged. But also to kind of, because what you tend to find is that you get a bunch of students that are really enthusiastic, and then when they go and graduate, how dare they, when they go and graduate, then unless you've got a champion and you've got that momentum, it kind of falls down the wayside. So it's how do we develop that kind of sustainable model whereby you've got that permanent interest through different students coming through. So that's what they're working on at the moment. And then I think the more we kind of raise the profile through like Dose of Nature walks and through their social prescribing scheme here, the better. And I think the more we engage the local community as well to come in and walk, and the more we get people walking around, people can see that, actually it's a nice place to walk. It's a safe place to walk. So it's getting the message out there really, but we're making slow and steady steps.
We've got the Monumental as well. So obviously that's been like with Sam and Jack up at the sports bit have done amazing, and then also we launched a staff one for Edge Hill staff as well. So that's going to be regular sessions where they can come and do different things, not necessarily sport all the time, but those two are they are up and running.
Brilliant stuff. All right. Well, I think we can start to wrap it up. Just if anyone's listening today and thinking about your own mental health or wondering about getting support and things like that, we've mentioned already that there is a mental health and wellbeing team here at Edge Hill Monday to Friday, 8:45 a.m. to 5 p.m. You can also phone them up. You can email them. You can pop to the help desk in the Catalyst building as well. People who may be listening externally, not on campus, wherever you are, the Hub of Hope is a brilliant place to find support near wherever you are, whether that might be the NHS, charity or local services. You can visit hubofhope.co.uk or you can download the app. If you've liked our conversation today, do check out the rest of the series. That will be wherever you get your podcasts, also on YouTube too. We will be back with more guests, more conversations that matter. Until next time, just keep talking, keep listening, step outside. That was the general sort of vibe of today. So thanks very much to you, Michelle. Thanks very much to you, Chris.
Pleasure, mate.
And yeah, look out for the next one.
This podcast is brought to you by Edge Hill University. Find your place at Edge Hill.